Hello, welcome to Telehealth Basics. My name is Brandon Drain, and I'm a part of a team from Michigan State University, presenting this series of videos that cover various aspects of what is generally called telehealth. This is part 4 titled Financial Fraud and Scam Prevention. In this video, we will cover why fraud prevention is essential in telehealth, the types of financial and healthcare fraud and scams affecting older adults, and key strategies and resources that can help protect them. Why do we address financial fraud and scams in our telehealth sessions? It is for two primary reasons. First, we recognize that such incidents can profoundly affect older adults' physical and mental health. Financial fraud can lead to stress that impacts sleep, energy levels, and physical pain. Psychologically, the effects can include mood swings, feelings of anger, shame, or lowered self-esteem, especially if the perpetrator, the person who did this, is someone the victim knows. This sense of betrayal, coupled with the stigma of being a victim, can significantly increase the risk of clinical depression or heightened anxiety. The second reason we address fraud and scams in the telehealth sessions is the increasing number of scams targeting older adults through digital means, such as phone, text, email, and online platforms. National data shows that older adult fraud victims experience significant financial losses compared to young adults. Data in Michigan suggests that approximately one-third of individuals aged 50 to 80 reported experiencing fraud, and almost 70% of scams attempted were through technological means. This survey also found that individuals with low income and those with poor physical and mental health are more susceptible to financial fraud. These insights underscore the importance of addressing financial fraud in our telehealth sessions. Financial fraud is defined as the act of depriving someone of their money or capital or harming their financial well-being through deceptive, misleading, or illegal practices without their permission. Financial fraud is typically committed by strangers, but can also be done by someone the victim knows. There are various types of financial fraud and scams, such as mortgage fraud and affinity fraud, where deceptive practices lure individuals into investments or mortgage loans, leading to financial losses. More common to older adults are identity theft, fraudulent government or business calls, and scams such as fake prize sweepstakes or lotteries. We caution older adults that legitimate government agencies, including Social Security Office, Medicare, or the IRS, will never initiate a call to request personal information. Receiving such a call should be considered suspicious and a potential sign of fraud. We have included healthcare fraud in this slide, which will be discussed in a moment. First, we'd like to show you a brief video. This video features a 90-year-old woman named Phyllis who fell victim to a tech support scam. After watching Phyllis's story, we will delve into what constitutes healthcare fraud.
My name is Phyllis Weisberg. I'm a 90-year-old widow. I have 4 children, 4 grandchildren, and 2 great-grandchildren, with another one on the way. I was the victim of an online scam. The scammers managed to get into my checking account. They removed $20,000.
Phyllis isn't alone. We are talking about a billion-dollar industry. And a key thing is that the over 60 population accounts for about a third of those losses.
This all began when my computer came up with a flashing light that it was unable to use it, and a phone number from Microsoft with a big ad that something was wrong with the computer and that they could take care of it if I would just call this number. And I called that number and they answered Microsoft. They were there to help me. They were the scam department of Microsoft, which of course it was not.
Anytime someone says, I'm from Microsoft, I'm from this company, I'm from that company, if they're calling you and you haven't called them, then huge red flag, not legitimate, hang up.
The first thing was they warned me. This was the only warning that I got. Nothing, no physical threats or anything, but a warning not to discuss this on the telephone because these bad guys could get in and hear all the conversations that were on the phone.
At the end of the day, scams are about psychological manipulation. And a key piece of psychological manipulation is getting people into what amounts to an isolated reality which gives the attacker greater opportunity to shape and manipulate that sense of reality.
And that's when they they sent me this list with the address of this foreign country and how to send a wire, which I had never in my life sent a wire before. I had no idea. And I thought, well, I'll go to the branch closer to home, where I always go, which is where I went. And that's where I had a very young fellow who I'd never met before in the bank. And he asked the same questions that they told me he would ask. Where is the money? Why are you doing this? And the answer was, it's a real estate venture, which was, of course, obviously not my idea. I had all the answers programmed for me, so I would give the right answers to him.
It's important to understand that Phyllis, to a degree, was kind of outgunned here, because we're talking about people who are professionals. They go in day after day and do nothing but phone tech support scams for 8 hours a day.
My first reaction was total embarrassment that I would do anything that stupid. And actually, it took me quite a while to get over this, that I was not the only one who was being taken like this. And all I can do is warn other people and just hope that this will help one person to avoid doing this. It would be a blessing to me to do it.
The internet can be scary, but we can be safe. And the key thing is just being ready to say no. Being ready to hang up the phone, being ready to hit the delete key, being ready to ask someone that you trust their take on things.
For decades, the National Council on Aging has been providing trusted information from our experts and our partners like Avast, empowering older adults to protect themselves.
It happened to me. Don't let it happen to you. Protect yourself.
The speaker in the video advised you to simply hang up the phone and refrain from sharing personal information if you suspect a call is not legitimate. Some common red flags of scams are unexpected contact, a sense of urgency, attempts to isolate you from people you trust, and often requests for money transfers. These are all signals to pause and verify before responding. Now let us look at healthcare fraud, which can be committed by a healthcare provider. Some examples are billing for services not provided, billing for the same services more than once, and providing inadequate care but charging for more extensive services. Other examples may include charging for a more complex or expensive service than what was actually provided, billing for a service as if it were covered by insurance when, in fact, it was not. It's crucial to carefully review your medical statements or bills to ensure that all listed items or services match up with your insurance coverages. Healthcare fraud can also be committed by other parties or even patients themselves. During Medicare's open enrollment period, older adults might have encountered telemarketing calls from insurance companies promoting their managed care plans with promises of services that may not be readily available in your community. For example, a plan might claim to cover dental or vision services, but such specialized services are hard to access, especially in certain areas. Or they might offer incentives like grocery cards, which become difficult to redeem if the relevant stores are not present in your community. This practice is often referred to as bogus marketing. Additionally, healthcare fraud can involve impersonation, where someone without the necessary license or credentials pretends to be a healthcare professional, claiming they have the authority to provide healthcare services. Furthermore, healthcare fraud can sometimes be committed by patients themselves, such as using another person's ID or insurance to receive services that are not generally covered within their own insurance plan. To avoid healthcare fraud, it's crucial for patients to protect their health insurance information as diligently as they will protect their credit card details. Do not share it with others, and be cautious when providing it at the doctor's office or pharmacy. Beware of offers for free services. If you're asked to provide your health insurance information for services claimed to be free, it is likely that the service is not actually free and could result in fraudulent charges to the insurance company. Furthermore, always review the explanation of benefits provided by your insurance plan. Verify that the dates, locations, and services billed match what you received. If you notice any discrepancies, immediately contact your health insurance provider for clarification. So far, we've discussed what financial fraud is and common types of financial fraud, including healthcare fraud. We have provided simple tips on how to protect yourself from such fraud. While many of you may already use the strategies on this slide, let's take a moment to review them for further fraud prevention. First, it's essential to regularly review your accounts and change your passwords occasionally. Be sure you record them in a secure yet accessible location. It's common for us to forget passwords over time. Exercise caution with online transactions and verify all financial communications. It's also wise to check your credit reports periodically and dispose of personal documents carefully. When faced with scam phone calls or messages pressuring you to make quick decisions, recognize this as a red flag. If you did not initiate the call and feel rushed to decide, take a moment to pause and even hang up the phone. Seeking the opinion of family members, a trusted friend, or a caseworker from social services agencies can provide a valuable second perspective, helping you determine if the request is legitimate. I'm going to introduce one additional resource on this topic. It is the AARP Scam Watch web map. This tool allows you to monitor scam activities in your community. Simply enter your zip code in the search bar. The site offers several ways to refine your search. You can select the reporting period, for example, the past 6 months or 2 years. Then define a radius around your zip code and choose scam types. You can even specify who reported the scam, citizens or law enforcement agents, and the method of contact used for the scam. Was it through technology, delivered mail? Was it a door-to-door approach? Once you click search, you'll see the results. This is a practical tool for staying aware of the scams reported by residents in your community. I would like to highlight some takeaways from this session. Increasing our financial awareness is crucial. Remember, it's our money that's at risk. It's important to resist the urge to act quickly when faced with potential scams. Let's also be proactive in checking for popular scams within our community. Staying informed about this topic and knowing your local resources can be your best defense against financial fraud. If you find yourself a victim of a scam, it's essential to talk to someone you trust. This could be a family member, the police, or the Adult Protective Services for help. By reporting your experience to scam surveillance agencies, you not only help yourself, but also help to protect others in your community from falling prey to similar scams. Together, we can create a shield of vigilance to protect our finances and well-being. At the end of each video, we have prepared a learning check to help you see some of what you've already learned. You don't have to turn in your answers. Just think about them, and we'll look at the next slide for the correct answers. Here we go. Mr. L, who is 78, receives a text claiming his Medicare benefits are on hold, asking him to click a link and upload or share a photo of his Medicare card. Which of the following steps would you recommend? 1. Click the link on the phone and try to resolve the issue quickly. 2. Call the phone number provided in the text to verify. Or 3. Ignore the message and instead look up the official Medicare contact information himself. Last, text back and ask for a supervisor's name and ID. The right answer is C. Don't click the link or use the phone number provided. Instead, you should independently look up the official Medicare contact information, such as calling 1-800-MEDICARE, to verify whether the message is legitimate. Thank you for watching this video. We appreciate your time and engagement. If you have any comments, questions, or suggestions for future sessions, please feel free to contact us at virtualconnect@msu.edu. You can also give us your feedback in the comments section after the video. We look forward to staying connected with you.